Hi everyone, hope you guys are having a great day. So today I would like to hop on and then talk a little bit about carpal tunnel syndrome and then 3 great exercises or stretching exercises that can help to relieve carpal tunnel syndrome, the symptom of the numbness tingling going on. So first of all, we can talk about the mechanics of it. So carpal tunnel is pretty much like this. I'm using some pens and markers and a rubber band to make an analogy of this. Carpal tunnel is a ligament on top of several bones in the wrist that's forming a channel, a tunnel, and then we have several tendons going into our fingers that pass through the tunnel, and then also the median nerve that passes through the middle of the tunnel. And then so whenever there are thickening, inflammation going on happening at the ligament on top of the carpal tunnel, or some thickening, swelling happening of all the tendons, then the pressure within the tunnel will be increased, and so the nerve would be compressed, having pressure, and then the nerve starts to be angry, and then that's why we are feeling some numbness, tingling for carpal tunnel syndrome. And then also for some folks, there might be some weakness happening in their hand. So the stretches are basically trying to restore the space within the tunnel so that the circulation to the nerve can be better, and then that's how the stretches, the exercises I'm gonna show you guys can be effective in managing the condition. And then so the first one, I call that a rainbow stretch. So a rainbow stretch is you start by crossing your arm to the opposite shoulder, and then you draw a rainbow all the way to the side. And then it's very important to the side, everything, the forearm, the inside of your arm is facing to the ceiling, and then you are straightening your wrists, pointing your fingers towards the floor to fully elongate all the soft tissue there, and then come back in. You straighten everything out and then come back in. And then remember that to manage carpal tunnel syndrome, nothing is a sustained hold, because nerve cannot be stretched. Nerve is not muscles, it's not elastic. It can only be glide and mobilized, but it can never be stretched. That's anatomically different for nerves compared to muscles. And then make sure the entire process of the rainbow is a stretch, so you need to fully elongate your arm all the way out and then all the way in. And then the focus of this exercise is gliding the median nerve to move it long and then move it short. So it's kind of like creating a gliding type of motion of the median nerve happening within the tunnel. And so the circulation would be better this way. And then also, when during the process, we are fully elongating the arm all the way, it's kind of creating the effect, creating some tension along the fascia, which are the soft tissue that will eventually connect it to the ligament on top. It can create a very minimal effect of pulling it out and then coming back in. A very mild pull and then coming back in. Very, very minimal amount of enlarging the space during the process. So that's why it's very important to reach all the way out and then all the way in. That's the first exercise. I call that a rainbow stretch. And then the second one is a prayer stretch. The prayer stretch will be more targeting on the transverse carpal ligament, which is the ligament I talked about on top of the carpal tunnel. to create the same effect of stretching, opening, and then loosening the ligament on top. And then the way to do that is you simply put your palms together to form a prayer position, and then you go as low as you feel, a little pull, a little stretch there, and then you come back, and then you switch to your fist, and then you go down fist by fist. You go up again, prayer, stretch, and then fist against fist. This is the same thing that create a little bit of opening, mild stretching, and then release of the ligament, the top of the carpal tunnel, very, very mild. And then it also creates some very mild gliding of the median nerve happening within the tunnel. That's the second exercise. I call that a prayer stretch. And then the third exercise, I call that the air guitar. But then basically it's you just flex your fingers along the second joint from your palm. So it's like this. It's not a full fist. This is wrong. You only flex the second joint of each of your hand. And then if you want to have a better control, you can totally stabilize with the opposite hand, the air guitar. And then the reason why this one is effective is because we not only have the tendon in the carpal tunnel, again, like I said earlier, other than the median nerve, we also have other tendons within the carpal tunnel. So by just doing the air guitar exercise, we are able to isolate each tendon and then create gliding happening at each of the tendon, which can kind of provide a plumbing effect that can also increase the spacing, improve the circulation within the carpal tunnel, and then that's how to relieve the pressure within the carpal tunnel that's causing carpal tunnel syndrome, and then causing the numbness, tingling, and then even weakness in our hands. So these are the 3 good exercises to do to help you manage carpal tunnel syndrome. And then last but not least, I also want to talk a little bit about why people would develop carpal tunnel syndrome. It's hugely because nowadays we are using our computers a lot, and then most of the time our tables are too high, or our seats are too low, or some sort of setting about our seats that's having some problem. And then eventually we are putting a lot of pressure onto our wrist, and then especially when we are typing, we put too much pressure on our wrist, and then that's causing some extra pressure at the carpal tunnel syndrome. So a very easy fix is to make sure the height of your chair, your stool, and then the height of your table is proper. So if it's appropriately set up, you should be able to put your forearm on the surface of the table. My elbow is at 90 degrees. And then forearm is fully supported so that my shoulders are relaxed, my arms are supported. And then if you have better chairs, it would be great if they have some sort of arm supports, and then that can help your muscles to relax better, and then so you won't build up too much tension in the carpal tunnel in your wrist. So these are the exercises and the tips, and then some knowledge about carpal tunnel syndrome. And I hope guys learned something, and then if you have any questions, feel free to let us know. I'm Andy Zhang, physical therapist and occupational therapist at Core Therapy and Pilates. And then if you ever have any question, feel free to give us a call at 512-215-4227. We look forward to working with you. Have a great day, everyone.